Thank you very much for inviting me to participate and also to be one of the initial uh, uh, founders and creators of this very wonderful organization, I believe. And I think that we have a very important opportunity to set the stage and set the dialogue for ongoing conversations. From I was asked to speak about how leadership can be adapting. I call it adaptation of leadership during healthcare crises, and also when new things are developing, and also how to communicate this, not just to the public, but also to other leaders. Yes. I'm a formerly trained critical care specialist. So we're trained to understand that what we're doing today is going to be the wrong thing tomorrow. So that we have to constantly understand that in our field of healthcare, it's an ever-changing, ever-evolving perspective. Having also spent 25 years of being a teaching doctor at the Mount Sinai School of Medicine in New York City and New York Medical College, I learned a lot about how to create leaders and also how to prepare them for the future. Unfortunately, there is a tendency in our field and in the world in general to tell people that this is the recipe. This is the way that it should be done. And this is the only way. And sometimes it cannot change. Because if it changes or you try to change it, you're a pariah. You can be ostracized and criticized. We are all healthcare professionals. We are all scientists. That means that we're constantly learning. That means that we have to have a proper mindset of understanding that we do the best that we can with the information that we have in front of us, with the full understanding that it might change. Circumstances might change. For example, the coronavirus pandemic has shown a lot of things to us, good and bad. But it is our basic skills, education, and open-mindedness that will carry us through this whole pandemic. Learning, unlearning, and creating for the future, and also educating new people. So when we talk about a healthcare leader, the word leadership can be a double-edged sword, because I am the leader. I am the boss. I'm the one that knows. And we first have to understand that we have to be very humble. Humble in understanding that sometimes we are given the privilege, the honor of being a leader. One of the things I always taught my students is that you have to understand that it is the patient that has given you the honor of you treating them. That's a very sacred honor. And that also applies to what it is when you are a healthcare leader. One of the issues that we have to train ourselves for, and also set, as all my colleagues wonderfully stated, that we have to establish a pattern of leading by example, but that leading by example also means being humble by example. Teaching the people that we don't have all the answers, that we don't know all the answers, that we might never have the answers. But as a true leader, we try to chart a path. We try to chart a path that maybe will get us as far as we can, and maybe we as leaders will not be able to finish the journey, but somebody else, the new generation, or sometimes the old generation, will be the ones that will carry us through. So specifically, when you are a leader in a crisis situation, sometimes the tendency to become an autocrat, to take control and say, this is what we need to do, that has to be balanced. Sometimes we do need, again, as an intensivist, I get called in by other doctors to help take care of very sick patients. At that moment, sometimes there's no opportunity for a full discussion. A decision has to be made. But understanding that at the same time, you have to also educate your other colleagues and also educate the public or the patient. And that's a very difficult task to do. And most leaders have a hard time doing this. Not just leaders in healthcare, but also leaders in the world of politics and even in business. And unfortunately, we've had too many examples in the general world of people that have faltered in the settings of the coronavirus. So when we look at a health leader taking control in a situation of a health crisis, you're playing many different roles. You're seeing what's going on. You're trying to make a decision as to what it is that needs to be done in order to put out the fire, put it under control. But at the same time, you're learning. At the same time, you might realize that what you've been taught is wrong and then immediately come up with a new way of looking at things. And at the same time, on a third basis, you have to educate the people around you, the people that are looking to you for guidance. So that's a very difficult job. And as our colleague was just saying a little while ago, we are trying to create leaders. We're trying to educate and promote leadership. But maybe one of the things that we have to be concentrating on is just creating people that have a good sense of humanity and a good sense of logic and what we call in critical care, critical thought process. Because we do want to teach people to be good leaders, but we also want to teach them to understand that a lot of times they're going to be faced with situations that they are not going to be able to handle, that they're not going to be able to understand, but yet they can still be leaders. They can set the path. They can set the course. One of the things that concern me a lot in healthcare, and I tell people, imagine about 50 years ago, a very crazy doctor came to a patient and said, you know what? You have a heart issue. You have a blockage in your coronary, and I'm going to take a vein from your leg and sew it in your heart to bypass a coronary. At that time, that was crazy. That was unheard of. Now it's routine. Now we do all those surgeries a day. That is what the field that we're in. What I want to lead towards right now is this concept of what we call evidence-based medicine. Now it's called performance or precision medicine. That's good. That has a place. But in the real world of medicine, it can be destructive because sometimes it makes people resistant to change, resistant to adaptation. I have a book that I love to read, and I read it all the time. It's called Studying a Study and Testing a Test. It's written by Richard Rangelmountain. Again, it's called Studying a Study and Testing a Test. It's a book about studying the things that we say are the standards. It's a book to study about what we think is the norm and realize that maybe it's not. That is the nature of our field in healthcare. And as a healthcare leader, we have to be willing to accept that maybe we are wrong. As I said before in our previous discussions, here in the United States, the most richest and powerful country in the world, in which we spent $4 trillion in healthcare last year, in 2 weeks. 2 weeks, the whole system collapsed. Why? Because we were not prepared. Why? Because we thought we were prepared. Why? Because we thought that we were ready and we had everything we needed. And one last thing that I'd like to finish is anytime we talk about healthcare leadership, anytime we talk about doing what's best for the community, education and everything, we also, as a healthcare leader, have to be mindful that unfortunately, the cost is always a factor that we have to consider. And so as an efficient healthcare leader, especially in a time of crisis, we have to be able to speak to the people that have access to the funding for changes in healthcare. Changes sometimes that are very expensive. We have to be able to communicate with them and explain to them how an expense today that nobody was preparing for would save us money in the future, or more importantly, will save lives in the future. So in summary, when we talk about healthcare leadership in a time of crisis especially, we have to be able to not just communicate amongst ourselves, to teach and learn and listen, because we don't know everything, but we also have to be effectively teach the community, because one of the things that we have all seen during this pandemic is how ineffective communication to the community, and sometimes by design, can cause major problems. Hence why here in the United States, we are having more. We just hit 90,000 patients hospitalized today in the United States. And we're going to be hitting nearly 260,000 Americans dead because of inefficient leadership. And sometimes that inefficient leadership is remaining silent. Thank you very much, everybody.
Thank you so much, Dr. Hector. Thank you so much. Now,